What role do centers of excellence play in order to improve the diagnostic journey for those with rare conditions?
For a lot of families, healthcare is really intimidating, or really irritating, or just really expensive and hard. So by creating centers of excellence, what we can say is, here is a place that we are trying to create that is open and accepting and wants to help with those hurdles. I'm not saying there's not a hurdle. You're still gonna have to get there. You're still gonna be intimidated the first time you walk into a center of excellence, but hopefully we've made that hurdle a little bit lower, and we've made it so that there's someone to go over the hurdle with you. That's what centers of excellence do.
So we have to kind of take a few steps back and think about the ways that we engage, that we build trust, and that we recruit and retain diverse communities in data collection initiatives, which can then hopefully give us a bigger sample size for us to connect the dots and kind of analyze the patterns that are seen so that we can then think about what a diagnosis looks like for a certain population.
Those are places where there is knowledge, interdisciplinary knowledge. They work on a hub and spoke system so that that knowledge can get spread out into the greater area. And that allows providers who have questions who are outside of the rare disease centers of excellence to dial into a group who can potentially unravel the mysteries of diagnosis for a rare disease patient, the kind of patient they may have never seen before.
Centers of Excellence program that it launched over a year ago is an important part of what we see as the future reimagined for rare diseases in the United States. Right now we have 31 centers in our network, and we expect that to expand. They are amazing institutions with dedicated, passionate, brilliant people who are work in the field of rare disease now and understand the challenges that the rare disease community faces and are committed to working with NORD and NORD's member organizations and the patients in the community to address those challenges. They're coming together in a way that we've not seen in the United States before to hopefully rise the tide for all boats in the Bay.
Understanding the long-term investment of building trust. If we're going to think about diverse communities being a part of data collection initiatives, which will lead to eventually better diagnosis, how do we take better care of systematically making the healthcare system a more welcoming space, again, for those who might be socially excluded and thought of as diverse, thought of as marginal? How can we create systematically a better system for them to have trust in, for us to then be able to account for the numbers that we need, to account for them wanting to engage with the system, to answer and ask questions?
By working together and investing in trust, we can improve the diagnostic journey for those with rare diseases.